Here's what your NCLEX is actually going to test you on. Basically, the categories that it's broken down into. First category is safe and effective care environment. The subcategories are management of care. So you're looking at delegation, prioritization, ethical, and legal stuff. So which patient should the nurse see first, or which task can the LPN delegate to a CNA? Another subcategory is safety and infection control. So you're looking at isolation precautions, fall risk, and med errors. An example, like what PPE is needed for C. diff, or which patient is at greatest risk for falls. Second category is health promotion and maintenance. So your subcategories of this are going to be growth and development, screenings, education, and prevention. Some examples might be what vaccine should a 2-month-old receive, or which teaching is most appropriate for a first-time pregnant patient. The third category is psychosocial integrity. So you're looking at mental health, therapeutic communication, crisis intervention. An example might be what's the best response to a patient with anxiety, or which behavior is most concerning in a depressed client. The fourth category is physiological integrity. Subcategories are basic care and comfort, hygiene, nutrition, mobility. So some examples might look like which meal would be best for a patient with heart failure. Another subcategory is pharmacological and parenteral therapies. So you're looking at meds, IVs, side effects, and interactions. An example might look like which lab should be monitored while a patient is on warfarin. Another subcategory is reduction of risk potential. So you're looking at lab values, diagnostic tests, and complications. So an example of that might look like which finding after surgery requires immediate action. Physiological adaptation, you're looking at acute care, fluid and electrolytes, and emergencies. So an example of this might be like which ABG result indicates respiratory acidosis. Again, it's not about remembering everything. It's about knowing what's safe, what's critical, and what the nurse should do first, prioritizing.